Brucellosis. That is chiefly a disease which cattle, goat or pigs can have. And it is the bacterium Brucellosis abortus because the cow loses its calf. It can get to humans if they are working with a cow who has a miscarriage or in slaughterhouses, or also if people drink unpasteurized or unsterilized milk from a cow who had it. And it can lead to fever and headache and weakness and fatigue. And the incubation period is 1 to 3 weeks, and it lasts for 6 weeks with treatment. With treatment, the outlook is good. The treatment is after taking blood tests to confirm the diagnosis, can be antibiotics and injections. If it is not treated, it can last over years in recurrent, and when the people can have over years longer periods of unwellness, weakness, and depression. And the female calves can be immunized against it. If a cow has it, that cow is ordered to be killed, and to not get it, the milk can be sterilized and pasteurized before it is drunk. And that is according to Keith Hodgkin's Family Medical Advisor book on the pages 103 and 104, but this is no substitute for medical knowledge and also no medical advice. Hi, Rebecca. I'm trying to learn medicine today, brucellosis, and after we've done that, we're gonna do squat training. And if you participate in the squat training, then it's with your risk. And we're talking about internal anatomy and diseases or something. And this is no medical advice, I'm just trying to read and to understand it. Brucellosis. This is chiefly a disease of cattle, pigs and goats, which is sometimes caught by humans. The disease is not very common in Britain. It is a British book from the 1970s, where the type found affects cows only. It is caused by a bacterium called Brucella abortus, which often causes the infected cow to abort. It is also known as undolent or abortus fever. Brucellosis can be caught by people such as farmers or vets who are in contact with infected animals when they are calving or having a miscarriage, or by people working in slaughterhouses. It can also be caught by drinking milk straight from an infected cow without the milk first being pasteurized or sterilized. It is not likely to be caught by anyone else. Okay, brucellosis. It is a disease of cattle, pigs and goats. It can be caught by humans. It is caught by a bacterium called Brucella abortus. Brucellosis, Brucella abortus, because it often causes the infected cow to have an abortion of its calf. And it can be caught by farmers and vets who are working with the infected animal when they are calving or having a miscarriage, and people working in slaughterhouses. It can also become if people drink milk without it being pasteurized first, if the cow had. Symptoms: fever in recurring attacks, headache, sweating, fatigue, weakness, and lassitude joint pains. I still don't know what lassitude means. So fever in recurring attacks, headache, sweating, fatigue, weakness, lassitude, joint pains. Incubation period 7 to 21 days, 1 to 3 weeks. Duration usually 6 weeks or longer without treatment. 6 weeks long or longer without treatment. Complications: not usually any, but very rarely the infection may affect the testes, lungs or heart, whatever the test is. Lungs or heart. Testes, lungs, heart. If any of the symptoms appear in someone who is in contact with cattle or goat, they should seek medical attention. What the doctor might do: take blood tests, prescribe a prolonged course of antibiotic tablets, give a short course of injections. So, taking blood tests to confirm the diagnosis, where antibiotics and also injections to treat it. Prevention. This depends upon eliminating the infection from cattle. Female calves can be immunized against brucellosis, but there is no necessity for humans being to be immunized. The female calves can be immunized against it. Farmers are obliged by law to slaughter infected animals. It can be that they are forced to slaughter them if they are infected, and do not drink milk until it is pasteurized or sterilized. That's a prevention. So to drink only pasteurized or sterilized milk, that if a cow has it, that cow has to be ordered to be killed, and female calves can be immunized against it. Outlook. With treatment, health should return completely to normal within a few weeks. Without treatment, the infection may recur over many years, and the infected person may feel unwell, weak, and depressed over a long period of time. Let's try to say that one point. This is very interesting. Over many years, the affected person may feel unwell, weak, depressed over long periods of time. We have information. Brucellosis, it is a disease which cattle, pigs, and goats have. It can get to humans. It is called also, it is the bacterium Brucella abortus, because the cow loses its calf, and it can be by miscarriage or calving, get into the people working with them, or slaughtering and drinking unpasteurized or unsterilized milk. Fever, headaches, sweating, fatigue, weakness, lassitude, joint pains, 1 to 3 weeks incubation, 6 weeks longer without treatment. It can infect the testes, lungs, or heart. And blood tests, antibiotics, injections. There can be immunized of the female calves, slaughter the infected animal, and not to drink unpasteurized, unsterilized milk. With treatment, normal health within a few weeks. It can lead, if not treated, it can recur over many years. The person can feel unwell, weak, and depressed over a long period of time. Okay, I'm going to start the second camera and let's try this in. Brucellosis. That is chiefly a disease which cattle, goat, or pigs can have. And it is the bacterium Brucellosis abortus, because the cow loses its calf. It can get to humans if they are working with a cow who has a miscarriage, or in slaughterhouses, or also if people drink unpasteurized or unsterilized milk from a cow who had it. And it can lead to fever and headache and weakness and fatigue. And the incubation period is 1 to 3 weeks, and it lasts for 6 weeks with treatment. With treatment, the outlook is good. The treatment is after taking blood tests to confirm the diagnosis. It can be antibiotics and injections. If it is not treated, it can last over years in recurrent, and when the people can have over years longer periods of unwellness, weakness, and depression. And the female calves can be immunized against it. If a cow has it, that cow is ordered to be killed, and to not get it, the milk can be sterilized and pasteurized before it is drunk. And that is according to Keith Hodgkin's Family Medical Advisor book on the pages 103 and 104, but this is no substitute for medical knowledge and also no medical advice. First up, camera. Did I not say there was one thing? No, those one. I'm going to stop the camera. And that was the medical part. If you're here for medicine, you can go directly to the next part of medicine, where we will continue with medicine. If you stay here and participate in the squat training, then it's better to be honest. One leg up. The mushroom. And the eating mushroom. And the waiting mushroom. Change. Other leg up. And take one leg to the ankle and make a straight leg. The crane, the other leg. One leg to a side, the torso pointing in front, stretch the inner side of the leg. To the other side, the train stop. And go from side to side, the mantis. Now squats. Legs wide apart, and we're doing 12. Number 1 and 2, 3 and 4, 5, and we're having the half. 7, and 8, 9, and 10, and the last two, 11, and 12. And now the 6-pack squat squeeze exercise. Quarter squat, press against the top part of the leg only on one side, and on the other side. Half squat, press in the middle of the leg, and on the other side. And 3/4 squat, press close to the knee, and on the other side. Okay. And now the fastest giraffe for water pond exercise. 3/4 squat, press against the knee, go towards it. Again, press, go towards it, press, go towards it, press, go towards it, press, go towards it, and the last time press, go towards it, and up. And rope propeller, the last exercise. Full squat, arms to the sides, over to one side, press against the leg, look up to one hand. Middle, over, press against the leg, look to one hand. Middle, up. And stretching. One heel onto the ground, pull the toes in. Put to the right, pull the toes in. To the left, pull the toes in. Middle, move from left to right. Other heel onto the ground, pull the toes in. Put to the right, pull in. Left, pull in. Middle, move from left to right. Take one leg up. Up one. Take the leg at the ankle. Change. Next to the sides, breathing that down. And out. In and up. Out. Breathe in and cross the legs. And breathe in and out. It was a squat training. I thank you very much, and until next time.